Hi everyone, welcome to my video on how do I prepare for the OSCE. There are many ways to prepare the exam, and today I am only sharing my personal experience. I am not going through the exam format or structure in this video. You can go to my video on FRCA overview to learn about that. Preparation for OSCE is very different from MCQ and OSCE. The exam syllabus is very wide and it weighs heavily on both clinical and fundamental knowledge. Its questions are UK practice oriented and might give international candidates disadvantages. Personally, I divide the reading materials into mock paper based and categories based, which I will explain in details. Just in case you are not aware, the OSCE has been held online during the pandemic, but it is now resumed to face-to-face format and will take place in London. To start with, the official guide from the college is almost essential. It contains mock paper of the exam with questions and key answers. It gives you the idea of the exam format and difficulty. You have to buy it from the official college website. This is a very good primary OSCE question and answer book. It is comprehensive, including topics that are common and uncommon, but important. These are the other valuable OSCE books that I've read. They are also being question paper sets. Apart from the mock paper, you have to read materials that are targeting the OSCE stations. So I would categorize the reading materials accordingly. For resuscitation station, I would highly recommend the Quick Reference Handbook from Association of Anesthetics. It includes an extensive list of common and anesthetic emergencies that gives step-to-step management guide, which is very good for exam. You can find it in my Facebook resources platform, Google Drive. Another essential reading material is the UK Resuscitation Council guidelines, including the ALS, ATLS, and APLS. The UK practice sticks to the DAS guidelines of difficult airway management. Make sure you read the general airway, obstetric airway, and tracheostomy management. You are also expected to know how to manage important obstetric emergencies. Apart from some online resources that you can read, I also find the obstetrics chapter in the Oxford Handbook quite well written. It is worth your time to read it up. Equipment is a huge topic in FRCA, and you can be asked from airway equipment to different measurements, machines, needles, and equipment that are relatively distant to us, like cylinders, MRI, fiber optic, and even clinic. It is quite often you get a surprise from an equipment station. Learn about the equipment distinct features, principles, uses, and related hazards. Try to read as broad as you can. Check out the materials in my Google Drive. Learn the equipments used in UK, like the Fenflon IV cannula, NR-Fit, spinal needles, etc. I have used the above book as a reference for equipment. For clinical data, ECGs with common emergencies like STEMI, NSTEMI, tachy and bradyarrhythmia, long QT, TCA toxicity, and plain CT head after head injury, cervical spine X-ray with fracture or rheumatoid disease, chest X-ray, both AP and lateral view, commonly appear in the exam. Interestingly, the exam likes to ask about coronary angiogram, so make sure you know the different views of angiogram and the basic anatomy of the vessels. For anesthetic hazards, read the AAGBI checking equipment guideline, which include the anesthetic machine check. You might get a machine check station. Read the WHO safety checklist, which is commonly used in the UK. Get an idea about the UK National Audit Projects, the NAP. Know what the NAP 1 to 7 are, and what are their main conclusions. Other hazards questions are threats to the theatre workers and patients, including electrical safety, scavenging, laser, heat loss, etc. Learn about these hazards and their respective precautions and the regulations. For technical skill station, you will get asked to perform procedure on a dummy. Apart from the commonest regional blocks, you could come across RSI intubation, changing tracheostomy, putting in intraosseous cannula or central line. Spinal, epidural, brachial plexus block, femoral, ankle blocks commonly appear in the exam. But you should also know about less common blocks, for instance, the lumbar block and stellate ganglion blocks. Apart from anatomy, landmarks, and technique, you also need to know about the indication and complications. The NISORA website is a very good way to learn, and you could access some notes in my resources platform under the anatomy session. Do not forget to score the easy marks, like taking a consent, monitoring, IV access, and position the patient. Candidates often forget to prepare anatomy, but if you prepare well, they are indeed easy marks to score. The above list are the favorites of the exam, and the quick draw anatomy is recommended by quite a few candidates. You don't actually have to draw the anatomy. They usually show you a diagram and ask you to label. Apart from airway assessment, other physical examinations are essentially identical to your undergraduate exam. They recruit normal candidates to be examined, and it is very unlikely you would pick up any abnormal signs. This should be a straightforward station, and you could easily practice with your peers. Communication station is usually about explaining a procedure, taking consent, discussing options, or counseling an anesthetic complication. The framework of these stations are fairly similar, usually starting with introduction and checking understanding, followed by explanation, exploring the patient's worries, or occasionally apologizing. History taking is similar in a way that you follow a framework and make sure you make good use of the time to go through everything. Do not drill too much details into a single issue that might run you out of time. Also make sure you score the easy marks like introducing yourself, drug allergy, and social history. By reading the marking scheme from mock papers and online materials, you can get an idea about the framework and you could practice with your peers. Peer practice is essential for OSCE. I highly recommend you to attend at least one of the courses. There are various OSCE courses available, and you can go to the above link to check them out. Some of them are held online. Personally, I have attended this Mosquito online course, which is quite well organized. It is a mock test with all stations, and you will get a feedback from your assessors. They also include some radiology teaching session into the course, which is quite useful as well. Apart from the OSCE course, they also provide some revision course and workshop that is catered for the exam. This is another online course that I've attended, which is also quite well organized. The OSCE is indeed a very difficult exam, especially for international graduates, in view of the scope of topics that could be involved. My recommendation is to read as broad as possible. Try to explore more about the local practice and guidelines. Read about the national audits, scoring system, equipments like NRFit. Remember to check out the supplementary session in my online drive. That might help you. Remember to give succinct and point-based answer. OSCE is a marking scheme that rarely asks you to explain in details. You usually get a what, list, or which type of questions. The examiner will guide you in the exam. Don't forget to score the easy marks in history taking, physical exam, and communication, and try the best for the rest. Try to form a study group with your peers and attend a course, and practice, which will be very helpful for your exam. Thank you for watching the video. If you found it useful and want more sharing, please give me a feedback by clicking the link below and join my Facebook platform. See you next time.